Hello, scholars. My name is Dr. Kerris Dillon, and the goal of this channel is to make academic subjects easier to understand. If you haven't already done so, please click that subscribe button so I can keep making videos that you enjoy. Now, in the last video, we talked about acute stress disorder. In this video, we're going to describe adjustment disorders, so let's begin. So in order to be diagnosed with adjustment disorders, the individual has to have the following criteria. A, the individual has to develop behaviors or emotional responses that come from stressors within 3 months of the introduction of the stressor. So as an example, let's say someone gets fired from a job. Someone could experience, it could come about right away where they're experiencing huge fluctuations in their mood. It kicks off their routine, or it can honestly come later. Maybe it takes them a while to kind of let that sink in. It could be 2 weeks down the road. But the stressor, the emotional response has to come within 3 months of the introduction of the stressor. B, these behaviors are significant because A, the distress the person is feeling is not proportional to the stressor, even if there are cultural factors that may play a role in the situation. So as an example, I like to use my celiac disease. When I was first diagnosed with celiac disease, there were definitely some stresses that came about with it in better understanding it. Just trying to grocery shop was difficult, so I had to now read labels on everything to see if there was wheat, barley, rye, malt, or oats. I can't eat any of those foods. So that definitely caused mood changes. It caused relationship problems with others. I definitely, within that next couple of months, really kind of had an adjustment disorder to that. That was very, very tough and very difficult. B, the individual has problems in their occupation, socially, or in other aspects of their life. You know, when being diagnosed with the disorder, it was very strange because I lost a lot of friends. I never knew that getting a disorder could cause me to lose friends, but my friends wanted to go to restaurants. They wanted to have certain meals. They wanted to, whereas I couldn't even hardly step into the restaurant because I would get sick from just being inside of there if tables weren't washed correctly or just other issues like that. So it changed my life in a way that I never thought it would change it. C, the reaction to the stress does not meet the requirements for any other mental disorder or is not an extension of another mental disorder getting worse. So again, as an example, if my mood had not shifted or changed, obviously now having, celiac disease for 12, 14 years now, my life has changed, and I have a few restaurants that I can go to. I have to go eat the same thing every time, but we try new things at home to try to compensate for that. It's still hard in a lot of ways, but my life I definitely have a lot less friends, but I have more closer friends than I ever did in my life. So it can bring about those things, but if I had not gotten over that adjustment, if I got very down about it and didn't want to go out, and it affected my sleeping, and maybe I lost a bunch of weight or gained a bunch of weight and started to lose interest in things over a period of time, then that shifts to something else. That shifts more to a depression, a major depression, depending upon how long that time period was. D, the symptoms are not average given a majority of people and how they cope with the stressors. So, what would it be like for you to lose your job? How long should it take somebody to kind of deal with that, the average person? And, is it something that you can adjust to and move on from? Or is it something that really pulls you away and affects other people that are around you? So E, once the stressors go away, the symptoms cannot stay for more than 6 months to be described as an adjustment disorder. So I like the fact that they put in that time criteria so you really know, okay, after 6 months, this is something else. If there is a depressed mood or hopelessness or relationship changes. So as the clinician looks at the patient, they want to specify if the person has a depressed mood. Do they break down in tears quite often? Do they have feelings of hopelessness? Is their mood low? They also want to specify if there's anxiety. Does the person seem jittery? Are they bouncing their leg, or are they fidgeting with their fingers? Do they worry quite a bit? Are they nervous quite a bit? Do they have some anxiety when their loved ones are not around them? A clinician will also want to specify if it's with mixed anxiety and a depressed mood, both of them in common. So there's a certain type of depression out there that has the mood and the anxiety that is mixed with it. So you really want to specify if both of those are present. And then lastly, you want to specify with issues of conduct. Are we seeing that person doing things that could potentially get them into trouble with the law or get them into trouble with other relationships? Are there conduct problems? Stressors come in all shapes and sizes, and people tend to deal with them differently. So if a person has a romantic relationship dissolve, or they're having problems with their business, maybe they have a painful illness come about, or maybe their business gets hit by a tornado, or maybe a hurricane. Maybe they live in Florida or somewhere near there, and they have a hurricane, or a child leaves home, failing to obtain occupational goals, retirement, crime in a neighborhood, even the death of a loved one. All of those things can bring about adjustment disorders. The scary part of it, though, is that adjustment disorders tend to have a higher risk of suicide attempts and completed suicide. So this is something that needs to be taken seriously, and it can happen quite quickly. It's pretty common to have an adjustment disorder because a lot of us have stressors and they can come about, quickly or over time. The amount of people trying to deal with an adjustment disorder each year can vary from 5 to 20%. And usually those are treated in an outpatient setting, meaning you go home with therapy, with medication, with exercises to work on. But if individuals end up in the psychiatric unit, there are 50% of patients that have this disorder. So it's very, very common. The beginning of an adjustment disorder will tend to take place about 3 months with the stressor arising within somebody's life. And then it does not last longer than 6 months, though. If the stressor comes about quick and makes a significant change in someone's life, like being fired, that adjustment disorder can come on quite quickly as well. But that's kind of one of those situations where we want to watch for other mental illnesses. For those individuals that experience trouble with money, there's a much higher risk for having an adjustment disorder. What tends to happen with adjustment disorder is there's a change in how a person performs, either at school or at work, or even the amount of activities that get done at home. And this can change people's relationships with other people. So if a person has an illness, this disorder can make the illness tougher to deal with. If a person has major depression, though, adjustment disorder usually isn't diagnosed. And that is it for adjustment disorders. If you have comments or questions, feel free to leave them in the comment section below. I'll try to get to them as soon as I can. I really appreciate everybody here that comes in and listens to these. I hope this helps you on your way with whatever you're doing, whether it's just learning more about mental illnesses or maybe you're studying this material for health care or psychology, or you are entering into the field of being a clinician. I really hope that every one of you has an amazing day, and I will talk with you soon. Bye-bye.